Hi, my name is Katie Guthrie. Today I'm going to talk about the medication Coumadin with a patient and his wife. I'm going to go over some main points, and one is reasons why we take Coumadin, explain the importance of blood tests, explain how to take Coumadin, explain the diet involved, and common side effects, and a possible medical alert, and why we should have one. Okay. Hi, my name's Katie.
Okay, I'm Danny.
Hi. Hi. I hear you just recently got prescribed Coumadin. Okay. Coumadin is used to treat or prevent blood clots forming in the body. For example, if you have a pulmonary embolism, which is a blood clot in the lungs, or a DVT, which is a blood clot in the veins in the legs, or your recent diagnosis of atrial fibrillation, which is an abnormal heart rhythm, which can really increase the risk of blood clots and stroke. Coumadin may also be used to reduce the risk of blood clots related complications after some types of heart attacks or surgeries, excuse me. While you're on this medication, you'll have to take a lot of blood tests. The reason you need to take blood tests is to measure how long your blood takes to clot, called the INR. If the blood clot's too quick, you're still at risk for a blood clot. But if your blood takes too long to clot, you're at risk for possible side effects, which we will talk more about later. Initially, you will need a blood test daily or every second day until the right dose is found. It takes about a week to find the right dose for most people. Once this happens, a blood test is only needed every few weeks or once a month. Your dose is changed based on your blood work. How to take Coumadin? You should take exactly how it's prescribed. That means taking the exact dose once a day at about the same time. The recommended time is with your evening meals. If you accidentally take too much Coumadin, contact your doctor. Coumadin can be affected by many other medications. And this includes prescriptions, non-prescription, vitamin, and herbal supplements. I want to talk to you a little bit about your diet. Some foods can affect Coumadin. Foods that are high in vitamin K are the most important. This is because the body uses vitamin K to help clotting. Some foods that are high in vitamin K include liver, broccoli, Brussels sprouts, or greeny leafy vegetables like spinach. Vitamin K is needed for a healthy diet. You do not need to avoid foods with vitamin K altogether. Instead, you want to use it in moderation. Also, large amount of alcohol can also affect Coumadin. Avoid heavy or binge drinking while on the medication. Bleeding is the most common side effect of Coumadin. Keeping the INR within the target ranges reduces the risk of bleeding. Other things you need to do to reduce the risk of harm due to bleeding include tell your doctor or dentist well before any planned procedure or surgery, and also avoid activities and sports that might cause serious injury. Now, some signs and symptoms I wanted to go over with you for unusual bleeding that you really need to watch for. For example, bleeding that is heavier than usual, or it takes a long time to stop, like a nosebleed, bleeding from your gums, bleeding from cuts and scrapes, severe bruising not due to injury that gets worse, red or dark urine, red or dark bowel movements, coughing blood, dark or blood-stained vomiting, or severe headaches and dizziness. If you have any of those symptoms, call your doctor right away or go to the nearest emergency room. And the last thing I wanted to talk to you about is carrying identification with you that states you are taking Coumadin. This might be a Coumadin card or medical alert. If you have an accident or become ill, ambulance and hospital staff need to know that you take Coumadin. By carrying this card or medical alert could really save your life. Do you guys have any questions?
Well, he's a little forgetful. So I was wondering, what if he skips a dose? What do we do?
That's a good question. If it's only a few hours since you missed the Coumadin dose, then you should take your usual dose at once. If you take your Coumadin with your evening meal and miss a dose, the missed dose can be taken anytime before bedtime. If it's more than a few hours since the missed dose, for example, the next day, don't take the missed dose. Don't try to play catch up. Don't double dose it. it's very dangerous to double dose. Just make a note that if you have missed the dose, and tell the doctor at the time of your next blood test. Okay,
Yeah, that's good.
okay.
Thank you very much.
You're welcome.
Yeah, thanks.